Beauty lies in the eyes of the beholder. And what exactly every person in this world is running about? They all want to look beautiful. Everybody wants to look good, right? Wherever they are going, they want to be presentable. So humans have a remarkable face. That is one thing that is the most striking feature of a personality given to humans. And that is the first thing that a person sees, right? Whenever you are watching the face of the person, the first thing or the first striking feature will be that what are the features of this person? So whenever we were looking, we call something called as this person has very sharp features. This person has very dull features. We are making out different interpretations just by looking the face of that person, right? That's how we are communicating. That's how we are seeing people each and every day of our life. Now, if I ask you, what is the first thing that you observe when a person is standing in front of you? What is that first facial profile segment that comes into your eyes? And that will always be the nose. So as always said, and this has been something in facial plastic surgery, that the nose is something which defines a human's face. If it is crooked, the whole face looks crooked. If it is deformed, the whole face will look deformed. If it is bulbous, my whole face will look asymmetrical. If it is too much pointed, I will look like a bird, right? So every possible thing inside the face or my facial symmetry depends upon one important organ. And that has been projected out in front of people and everybody is seeing that. So it has to stay in symmetry. So what exactly is that? It is the external part of the nose. That is how so much importance this particular feature holds, and our whole line of facial plastics is just based on correcting noses, right? There are only nose surgeons for that, who can just correct noses. So what I am going to deal is about this external framework of the nose. So before dealing about it, you must know in detail what exactly is the external framework anatomy and how you're going to examine exactly this external part of the nose. So what we are going to deal is exactly today's topic, and that is anatomy of the nose. So what in this segment I'll be covering is not about the endoscopic anatomy. I've dealt in much detail about paranasal sinuses, about endoscopic anatomy in the FES segment, where we read about functional endoscopic sinus surgery. So I'm going to exactly deal about what exactly the external framework of the nose is all about. And there are many questions into it because we have got a lot of tiny MCQs as questions that come from this segment, right? So we are going to see exactly what the external framework of the nose is all about, right? So as we all go right from the base to what exactly the topic is all about. So first we need to know the location of certain things. And then exactly we will do about the anatomy of this particular organ. So as we all know, our nose is made up of various walls, okay? So when I call nose, nose is basically a structure made up of two things. It is containing bones and it is containing cartilages. So I can say my whole nose is contained of a bony cartilaginous framework. So there are bones, there are cartilages, right? They are all conjoined together to form something as a framework that constitutes our nose. Now, where is the location? Definitely, it is in the upper part of our face as well as covering the mid part of our face. So the upper and mid part of our face is covered in the center by our nose, right? That is the importance of it. Now I'll deal with exactly what do you mean by this bony framework and what do you mean by this cartilaginous framework, because these are two important areas or zones which are quite different from each other, okay? So now I'm going to deal with exactly what your nose looks like and how exactly this bony and cartilaginous framework are. So first let's take up the bones, fine. So let's take up the bones now. So what exactly constitutes the bony framework of the nose? And this we will draw a diagram for it, as we always do, and we'll also draw a diagram for our cartilages. What are the bones in the nose? Okay, so for the bones in the nose, let's first put up a diagram. Okay, so this is suppose my one side bone, this is another side bone of the nose, and then it is coming down like this. So this is something your external nasal framework looks like. This is what I have drawn in here. This is like a pyramid. So my first point will be, how does my nose look like? It will be a pyramid, which is covered by skin, which is then covered by subcutaneous tissue, and then comes this framework. Now the upper part of the nose constitutes of my bones. So this is my bone. And these are my cartilages. Okay, so this segment of the nose is my bone. That is mean the upper segment of my nose is bony. Okay, that's why when you touch your nose here, it's quite hard. But once you come down and you touch your nose, you can easily compress it because this is the area which is cartilaginous. So I'm going to deal with this area first, then I'm going to go to this area. Fine. So what are the bones that are making the nose? So bones of the nose are called as what? Nasal bones, because obviously it is got to do with the nose. So there are two nasal bones which are present in the nose on both the sides. Okay, and they are joining with each other in the center. And what is this suture called as? This suture or the union of the nasal bones, this is called as internasal suture. Simple. Because there are two nasal bones which are joining together in the midline by a suture that is called as internasal suture. Now, one more important point. If you see this part of the nose, okay, now if this part of the nose is just not, randomly there, it is connected above, it is connected below. Now, what is this bone in my face? This is my maxilla, right? So my maxilla is here. Now, this maxilla is sending one process in here, like this. Okay, if you see, this all is going up, right? And here is my eye. Here is my eye, right? So this all is going up, like this. Similarly, something is coming down as a bone from here. So some bone is coming down from here, like this. So what are these bones also? They also constitute the bony framework of the nose. So if you see, it's a very simple logic. This is coming towards the nose. This is what area of my head? This is my frontal bone. So I can call it nasal process of the frontal bone. Because process is something which is going down towards the nose. So I can call it nasal process of my frontal bone. So my second constituent will be nasal process of my frontal bone. That is my second bone that is present in the nose. Okay, I'm dealing with the bony framework. Then I'll go to the cartilaginous. What is the third bone that is constituting in here? Third bone will be coming from the maxilla up to the nose. So what is that called as? This is called as frontonasal process of maxilla because it is going up towards the frontal as well as the nasal bone, right? So the third part of the bony framework will be frontonasal process of maxilla. Simple. Nothing is extraordinary here. It is all about basic terminologies that we can differ out just by the names of these anatomical orientations. What these bones are giving. One is towards the maxilla going up. So it is going towards the frontonasal. So it is a process of frontonasal process. One is coming from the frontal bone towards the nasal side. So it is a nasal process of the frontal bone. And one is itself present in between the orbit. And you can see it here, right? Okay. So that is called as a nasal bone. Now again, you are the intern, suppose you are in a casualty, you get a call that somebody has hit someone over the nose and he is a boxer, okay? And he has got a huge swelling, the person has come to the casualty. So this area is the one which is going to fracture the most, right? And he has a huge swelling over that. Now you have to order an X-ray. Now my first question will be, what X-ray will you order if there is a fracture in here? So my question is the X-ray here. So obviously there are two nasal bones, so we have to see both the sides. Now what exactly we do wrong in here is, whenever we are dealing with nasal bone fractures, we usually send one side X-ray. Now how do I know if it is the right side which is fractured or the left side which is fractured? That's why whenever we are dealing with nasal bones, we have to send bilateral lateral X-rays. So that I can see my bone from this side and I can see my bone from the other side. And both of the sides I can tell that my nasal bones are fractured or not. This is a clinical beginning. Okay, this is something that you need to know. That whenever you want to see nasal bones, you have to see from both the sides because they are two in number. And anteroposteriorly, you cannot visualize these bones very well on an X-ray because there are quite of overlaps over it. Okay, so that's the answer. The whole bony framework is made up of three important things. Nasal bones joined together by an internasal suture, frontonasal process of the maxilla, as well as the nasal process of the frontal bone. These are the three important terms that you need to know. Fine. So we are done with the bony work. Now let's go to the cartilaginous part. So what is the cartilaginous part made up of? So this is something interesting and we have got a lot of facial plastic surgery being done over here. Cartilaginous framework. Now for learning the cartilaginous framework, you need to know two important angles. Okay, so I'm going to draw you three type of angles through which you have to visualize this thing. One is this angle. So this is suppose a man, right? And this is his chin and this is the area of his eyebrow, right? And this is his eyes. Fine. So this is a man who's basically seeing from the side and here his forehead is starting, right? So this is something from the side profile. Okay, that's the importance in here where what I'm going to tell you is that what exactly is the significance of nose and how come small things in the nose will make huge differences in the facial profile. Okay, that's why external framework comes in. So this is a side profile of a man. Then let's put in your front profile of this man. Okay, so front profile of this man will be somewhat like this. He has a nose like this. So this is his front nose. Okay, and he has got openings of the nose in here, right? And he has got two important bones in here. And those bones you already know, right? Now let's put up his cartilages. So I told you, when it comes to the cartilages, there are two important segments of cartilages which are covering outside. Okay, I'm going to tell you that. So this is your cartilage now. Now it has started to form in below. This is something which is below. And these are your cartilages. One thing. So take this part out and you can make and cover this part of the cartilage together with that part of the cartilage. So this is how the cartilages are. So now why exactly these cartilages have been given and what exactly is the function of these cartilages is the important part. Okay, so this is something that the front part of the nose will be seen like. Okay, so this is my front part of the nose. What I'm seeing, this is the side part of the nose, what I'm seeing. Now I will draw another diagram in which I'll show you the inferior part of the nose where you see it like this. Okay, where you see it like this. So now you have got this part of your nose in which you see the nostrils. So these are your nostrils and these are the parts that you're seeing from inferiorly, okay? And these are my turbinates. Fine, so now I've got three sections of the nose and what exactly this cartilaginous framework mean. So what exactly do you mean by this cartilaginous framework? My whole external framework is made up of upper lateral cartilage, lower lateral cartilage, which is also given the name as alar cartilage, okay? Then there is something called as accessory alar cartilage. I'm going to tell you what is that. And the last is a part of septal cartilage, which is in the center. Okay, so I've given you three important ways in which you can learn it. I spoke about the bony vault that constituted three bones. This is the cartilaginous vault, which constitutes the cartilages. And these cartilages join with the bone to form a bony cartilaginous framework or a bony cartilaginous vault. That is what we have learned. Fine. Now, I'm going to tell you exactly what are these cartilages. Now you see here, okay, you see this particular thing, this, right? So here my nasal bones are ending. And then there is this cartilage that starts, this one. So what is this? This is my upper lateral cartilage. So if you see, it is present laterally, correct? And then it is obviously below my nasal bones. So that is why it is given the name as lateral cartilage and it is above, so it is named as upper lateral cartilage. So this is my upper lateral cartilage, which basically goes and it joins with this nasal bone. So it has got a union with the nasal bone. Okay, that is an important point. Then I have got one more cartilage which is below. Okay, you can see this particular cartilage which comes like this. And if you see, this is my ala of the nose. You can see here, this is my ala of the nose, right? So this is my lower lateral cartilage. And because they constitute the alar framework, that is why they are called as alar cartilages also. Okay, they are constituting the alar framework. Now, if you very closely observe, okay, very closely observe, I have made this limb of the cartilage of the lower lateral cartilage a little longer. And I have curved it and made it a little shorter on the lateral side. And this is very important to understand. So if I say this, okay, and if I just see the nose from inferiorly like this, I will see my lower lateral cartilage, correct? I can't see the upper lateral cartilage in here. I'll see the lower lateral cartilage. So it has got this kind of a framework. And similarly, it is on the other side like this. Maybe you can make a little longer like this. So what is this? So you can see that this lateral cartilage or the lower lateral cartilage is containing two limbs. One is coming down, which is a little longer, and the other is coming on the lateral side, which is a little shorter. This medial one is called as medial crus. Lateral one is called as lateral crus. So these are limbs. On crura means limbs, okay, crus. So now you see this part, okay, see this part of my nose. So this is my upper lateral cartilage, this is my nasal bone, this is my upper lateral cartilage, now you come down. Now just palpate your nose in here, right? Move a little lateral and move a little medial. So you see this medially and you see this partition in here, this partition is quite cartilaginous and this partition is called as the columella. Now, if you ask me, what is the columella made up of? Answer is here. The columella is this partition, and it is made up of by the crura of the two sides medial crust of the lower lateral cartilage. That means that my lower lateral cartilage is coming like this on one side, other side also is coming like this, and in the center, they are making this partition, and this is called as a columella. Now you understand what is a columella, right? So this is by the medial crura of the two lateral alar cartilages which are coming down and centering into the midline. 1 point. Now, if you touch your lateral cartilage laterally, okay? So you see this part, it is quite compressible. It moves also, right? But above it, you can feel the cartilage. So my lower part of my lower ala, or basically my lower part of the ala, does not have cartilage. It is only the upper part of the ala which has cartilage, and you can find a crease in here, right? You can see this crease very well. You can define it. That crease is present. That crease is the area where my lower lateral cartilage, lateral crus is ending. Always remember, that is why my lower lateral cartilage, lateral crus is ending, and I have a crease in there. I have a crease in there. So basically, this is my part, this is my lower lateral cartilage, so I'll have a crease in here. And I'll be able to see that. You can see, everyone has a crease over it. That is why this, because it's the cartilage shape which comes like this. This part is not having, it's mostly fibrofatty tissue and muscle that is present in here. Now 1 point. I've given you the name as accessory alar cartilage. In some people, you can also have a small part of an alar cartilage like this here. So it may also be present in the lower end after below the crease, you might find a small sesamoid cartilage or accessory alar cartilage which might be present. Okay, that might also constitute just below the lower lateral cartilage, so that might be present in there. That is another point. Now comes the last point. That is the septal cartilage. Now what is the septal cartilage? Septal cartilage is in the center. So if you can see here, everything is coming to the midline. So my nasal bones are joining with each other. But what about my cartilages? Where are they joining? So the cartilaginous join in the midline through the septal cartilage. So my septal cartilage is like this. It is in the center. So all the cartilages on this side and this side are finally joining in the midline at the septal cartilage. So you see here, this will be my septal cartilage in the center here. And the septal cartilage will be the strip on which all of these cartilages will be joining in the center from both the sides. Okay, so always remember that. So this is how you define upper lateral cartilage, lower lateral cartilage, what is medial crus, what is lateral crus, what is accessory alar cartilage, which is just an accessory sesamoid cartilage present in some people, not present in some people. If it is not present, it is just fibrofatty tissue in here. And these are the 4 ways in which you can find or you can make your cartilaginous vault. Fine. So this is an important part, okay? Always remember that. Now an important point. Now I come to dimensions. So what are the dimensions of the nasal cavity? So if you see my nasal cavity from the anterior quana, if you go posteriorly, this diameter from the anterior to posterior quana is around 5 to 7 centimeters. It varies after birth, okay? So it is around 5 to 7 centimeters from the anterior to posterior quana. I have a broader base and I have a narrower roof. So at the base, my transverse diameter is around 1.5 centimeters. So that means at the base of each side, okay, of each side nostril, this one and this one separately. So each side nostril base is basically at the floor, it is 1.5 centimeters. And once I go towards the cribriform plate or the roof, my diameter decreases to 1 to 2 millimeters. That's how constricted the roof are. So this is my anteroposterior, 5 to 7. At the floor of each nostril, my diameter is around 1.5 centimeters. When I go up to the roof, it is around 1 to 2 millimeters. That means it's like a pyramid if you see here, right? And it's quite constricted and it's open at the base and it's again tapering at the apex. That's why it's called as a pyramidal in shape bony cartilaginous vault. And you know what the bony is all about and what the cartilaginous is all about. Okay, now we already know. Fine. Now let me give you some important one-word MCQs that can come, and they are very important as far as external nasal anatomy is concerned because these are certain angles and these are very much important when your plastic surgeons are coming, okay? So external framework anatomy is very important when we do rhinoplasties, okay? When we are doing rhinoplasties, and rhinoplasties is the most commonly done procedure for ENT surgeons when cosmesis is concerned. So whenever we are going for cosmetic purposes, or there are so many actors and actresses who are undergoing these procedures of just to make their nose straight. So ENT surgeons who do this part are basically the rhinoplastic surgeons. And what do? Is basically they align the nose in the correct way. They make the appropriate angulations correct so that the nose is quite, is in the best form and fits according to the face or the facial symmetry. Now for that, you need to know certain landmarks. Okay, now what are these landmarks? So let me again show you a side profile of this person. So now you know that this is your frontal bone, this is your frontal bone. You have these eyebrows, right? In between the eyebrows, this is a space. You usually use it for a bindi, okay, where you put it. Okay, what is that space called as in the center? This is called as a glabella. So you start from the glabella, which is in the front. Okay. Now this person has got his nasal bone, which is like this. Okay, so this nasal bone will be coming like this. Then it will be his upper lateral cartilage. Okay, and then after that will be his lower lateral cartilage, which will be like this. Okay, this is the way we have studied this. So it starts from the glabella. Glabella is a point which is present in between the eyebrows. Always remember that. Now, draw a line from the start of his nasal bones and draw a line from the lower end of his nasal bones. So from the start of his nasal bones or at the junction of the frontal bone and the nasal bone, that suture, that basically mark where your nasal bone is starting from the frontal bone, this mark is given a name here. Okay, so what is the name of this part? This is called as nasion. Nasion. Okay, so the start of your nasal bone, where your nasal bone starts, is called as nasion. Then comes the lower end of the nasal bone, where it ends and your upper lateral cartilage starts. Okay, what is this called as? This is called as rhinion. Rhinion. Okay, I'm going to tell you what importance is. Then there is a mark that is present in between the nasion and the rhinion. And this mark is very important, and I'm going to tell you that. What is this mark called as? In between the nasion and the rhinion, there is one point. And this is called as celion. S-E-L-I-O-N, celion. And this is commonly also given the name as radix. Okay, so first is the start, nasion, then is a celion or the radix, then is your rhinion where your upper lateral cartilage starts and the nasal bones end. That's called as rhinion. Okay, now what is the chin called as? Chin. Okay, this chin or mentum, what is this called as? This is called as pogonion. Pogonion. Okay. Now you come down. What do you mean by this? This is called as tip. This is called as a tip. Okay. Now these are the regular landmarks that we have in facial plastic surgery or in case of rhinoplasties. These are the regular landmarks that we follow. Okay. So you can be asked what is the radix? What is the radix called? It's celion. What is the chin called? Pogonion. What is nasion? What is rhinion? These are one word MCQs that are quite commonly asked in external nasal framework anatomies. Okay. Always remember that. Now I'm going to tell you certain angles which are very important in nose. Angles, okay? So what is the angle that is formed in between the nose in here as well as this frontal bone? Okay, now if you see here, my face, okay? This is my frontal bone which is ending and my nose is starting like this. So this you can see an angle in here, right? This angle has to be very fine. Sometimes people have a dorsal hump like this. So what will happen? Their angle usually is not very well formed. Some people have a very saddle nose in which it dips down like this. So their angle is also deformed. It is much more acute in those people, right? So this is called as nasofrontal angle. Okay, so this angle is called as nasofrontal angle. Right? So this angle is very important in people. And how much this angle should be in order to have a person with a beautiful face, okay? So this angle should be around 110 to 130 degrees. Okay, so my this to this angle should be around 110, approximately 110 to 115 to 130 degree. And this angle is very important for our beauty. So if I'm seeing someone from the side, I can exactly make out this angle and I can say, okay, his nose has a problem. Either it is too bulky or it is bulged out or it is depressing. Okay, that's how an eye of a rhinoplastic surgeon is. They can catch your nasal deformities. Okay, fine. So this is your nasofrontal angle. Now you come down, okay. Now down you come, so this is what? This is your nose and this is your upper lip. Now you see this angle, Okay, so it's easy. This is called as nasolabial angle. Okay, because it's a lip. It's called as nasolabial angle. So this nasolabial angle is around about 90 to 110 degrees. This is another beauty point. So some people have a pinched up upper lip. Some people have a big bulbous upper lip. Some people have a deformed nose down. Some people have a supra-tip deformity with which the nose is up. So in all these cases, this angle will get changed. So now you can understand how we are making out that people have crooked noses, what is deformed nose, how do they have this, and what we need to correct, right? We do surgeries because of this. Okay, so that's how we align it. So this is around 90 to 110 degrees. Now comes the third angle of beauty. And what is the third angle of beauty? Third angle, if you make a line from your glabella, okay, down to your pogonion. So this is your one line, okay, and one line that starts from here along the nose, like this. So this is the nose to face angle, also called as nasofacial angle. And this nasofacial angle should be around 36 degrees. So nasofacial angle, which is around about 36 degrees. Remember that. So I've told you three angles. One is called as a nasofrontal angle, one is called as a nasolabial angle, one is called as a nasofacial angle. So all of these triangles, all of these angles, they usually constitute the beauty of our face. How can we know that the person has a crooked nose or we have to correct it, and why do we do surgeries? If you see these actors and actresses, when they come and they get their nose corrected, the alignment corrected is basically upon these angles. This is how we are defining their angles and, making them more sharper so that that contrast over their faces change. Right? And they do remarkably well, because if you see facial plastics and rhinoplastic surgeries, that is one part, rhinoplasty is one part of ENT domain in which you can change the face of the person just by changing the nose. The whole face symmetry changes. Okay, that is how nose is important, because you can spot from a 1 kilometer distance if the face is deformed by the nose. That's how bad the nose looks once it's crooked. Okay, so these things you should know. If you're learning ENT, you should know what are the basic anatomies and what all angles are formed by the external nasal framework. Fine? So this is about in general what, external nasal framework is all about. What exactly they are made up of, what is the bony vault, what is the cartilaginous vault, what are these points, okay, over on and what are the angles of the external nasal vault. Now, what is the nerve supply of your external nasal part? The nerves are two infra. So one is infratrochlear nerve, infraorbital nerve, and external nasal nerve. So remember these three names. There are two infras in here, infratrochlear, infraorbital, external nasal. So all of these supply the external part of the nose. That's all. It's very, very simple, right? Okay, so these are the nerves that supply. Now one important part, okay? This is my external part of the nose. So what about my internal part? The internal part of my nasal cavity is again divided into medial wall, which is my nasal septum, lateral wall, which is again my ostia of the sinuses, or my lateral nasal wall basically constitutes with the turbinates, roof, that is my cribriform plate, and floor, which is made up of two important processes, palatine process of the maxilla as well as horizontal process of the palatine bone. So I have covered in detail about the medial wall in the nasal septum segment, lateral wall in my functional endoscopy sinus surgery segment, and also about the roof and the floor in the segments in which I have covered these two parts. So I'm not going to deal with those parts. In this proper segment, I'll only deal with the external nasal framework, okay? So if you want to read about all those things, you can go into the chapter on nasal septum as well as into the chapter of FES, where you'll get all the internal or the endoscopic anatomy of the nose. Fine. So you should know about the external first, then go and read about the internal nasal framework, or what exactly is the endoscopic anatomy of the nose. Fine. Now just 2 points in the last. What actually is important for Viva point of view, what is the concept of nasal valve, okay? So this is important. Why? Because in Vivas, this is quite a lot favorite question. So nasal valves are the narrowest area of the nose, or basically they are the valve-like mechanism where basically your air currents, they are importantly changed. Your important air currents are changed in these areas because these are constrictions that are present, okay? That's why they're called as valves. Now, there are two important nasal valves. That is, one is external and one is internal nasal valve. Now, what is the external? External is nothing. It is a point of your nostril where it is starting. So, if you see here, This is a lateral crust. This is a medial crust. So in between the opening, right, this is the thing that you can change in diameter, flare it, compress it, all of this, right? So this is your vestibule. The starting of your vestibule is your external nasal valve. Remember that, okay? Now comes internal nasal valve. Now where is the internal nasal valve? So let me see first exactly. Let me draw like this, okay? This is suppose your septum, or this is your septal cartilage. Then this is suppose your upper lateral cartilage where it has ended and it has joined with the septum. And this is your lower lateral cartilage which is coming like this, right? This is the internal part of the nose and this is your turbinate. So you're getting the orientation. What I've done is I've made a cross section of the whole cut like this. And this is my upper lateral cartilage. This is my lower lateral cartilage. This is inside of the nose which has the turbinate, and this is medially my septum or the septal cartilage. So what are the boundaries of my internal nasal valve? Internal nasal valve is bounded medially by the septal cartilage or my septum. Just say it the septum. Okay. Laterally by the lower end of the upper lateral cartilage. So this is my lateral. That is my lower end of the upper lateral cartilage. And inferiorly by this turbinate or the head of inferior turbinate. So you can see this triangle getting formed. This is called as the internal nasal valve, which is the narrowest area of the nose. So if you are asked what is the narrowest area of the nose, this is the narrowest area of my nose. Now what is the narrowest area? This angle is around about 10 to 15 degrees and this is usually seen in Caucasians. So my Caucasian usually have 10 to 15 degrees angles and that is commonly seen. This is very important. Why? Because all our nasal pathologies can, basically if the person has a DNS, so nasal pathology, they can constrict this nasal valve. And because it is the narrowest area, this is the first one to get compressed and the person won't be able to inspire properly. They will have obstructive symptoms. So that is the reason this internal nasal valve is very important. Okay. Now another question for you. Which test do you do to test this valve? It is the Cortals test. Okay. So what do you do in Cortals test? Cortals test, you basically take your cheek and retract it. But once you're retracting your cheek, your lateral nasal valve is also retracting, okay? Your upper lateral cartilage is also going away. So if I retract my cheek, my upper lateral cartilage will go away, right? So it will open up this area. So that is how I can judge. If suppose this person is getting better or my Cortals test is basically it's getting positive because of, or the person is getting a relief on pulling his cheek, my Cortals test will be positive and I will differ out from that if I do a surgery of septum on this particular patient, he will have betterment of symptoms. Fine, that is what I'm going to infer from my Cortals test, that if I do a surgery, suppose I just take this septum off and I shave it off and I basically do a septoplasty and I correct it, his airway will improve. Because automatically this is the only segment which is getting compressed. So I can test by doing the simple test my internal nasal valve patency. And I can come to know whether there is any valve problem or whether there is any obstruction at the valve level and whether by surgery has to be done in that area or not. Fine? This is how important these small tests are. Okay, it's very simple to understand, but you need to know the anatomy in order to make these tests possible to understand. Right? So what is internal nasal valve? It is the valve that is the narrowest constriction in the nasal cavity which gives turbulence to your inspiratory currents, bounded by the medial side by the septum, lateral side by the lower end of your upper lateral cartilage, inferiorly by the head of the turbinate and the piriform aperture. This is around 10 to 15 degrees, mostly seen in Caucasians, around 10 to 15 degrees. They vary, but this is usually the whole soul dimension that is usually followed, 10 to 15 degrees. That's a normal diameter of your internal nasal valve. Fine? So this is about the external as well as the internal nasal valve. And what exactly do you mean by that? Fine. So we are done what exactly you mean by the external part of the nose. So what I did was I dealt in detail with your bony and cartilaginous frameworks, right? I dealt in detail with the nasal cavity dimensions and part. So I told you this is a segment in which I have covered only the external nasal part. I tried to give you a concept about what exactly your vault is made up of, how this pyramid is actually looking from the outside and what exactly you can differ. We read about facial angles and how they are important and useful as markers in deciding who has to undergo surgery and how we can tell that, this person can go a rhinoplasty correction or not. So the beauty of the face, we have defined certain angles and we saw those particular names of the areas that are given. I told you that the whole nasal cavity is divided into a medial part, the nasal septum, lateral part, the lateral nasal wall, osteomeatal complex. Floor of the nose has got two processes by the palatine bone and the maxilla, and the roof of the nose by cribriform plate. So this particular part I've dealt much in detail in the segments of nasal septum and functional endoscopic sinus surgery. But the take-home message will be that you have to study about the bony cartilaginous framework first before going into the whole world of the nose inside. You have to know the first pyramid, and then finally you need to know the inside of that pyramid. Okay, that's what the whole logic is all about. Fine. So as I told you, the whole beauty of my face is all because of my nose. If my nose is not correct, then definitely my face is not correct, right? So here only I'll just tell you one important, clue. Okay, this is one word which is commonly used in our layman's language. Sometimes we say this person has a crooked nose. Sometimes we say this person has a deformed nose. Are they related, or do we mean the same thing by them? So always remember, crooked noses are curved noses. That means they are crooked from this part, but finally they are central at the tip. The tip is not crooked. Okay, when I call a crooked nose of a person, it is only the dorsum which is crooked. It curves and comes back to the same place. It is like a curve. That's called as a crooked nose. But once I say a deformed nose, that means all shapes and dimensions of the nose is haywire. It's all gone there and here. Tip is also gone, even the dorsum is also gone. That's what I say with a deformed nose, okay? So whenever you're using these terms, this person has a crooked nose or this person has a deformed nose, try thinking about the logic when you are calling that. Okay, so this is all about external anatomy of the nose as well as the importance of that external anatomy in surgeries as well as in certain diseases.